Welcome to Health Bulletin, and today we bring you the latest updates on global health crises that demand attention. From California's worsening bird flu outbreak to Yemen's cholera epidemic, and from Mpox in Europe to rising HIV cases in South Sudan, there's a lot to unpack. Let's break it down. We start from California, where the avian flu crisis has reached alarming levels. 2 new cases of avian influenza A, H5N1, have been confirmed in Stanislaus and Los Angeles counties. Since August, the virus has infected 659 out of 984 dairy operations across the state. Governor has declared a state of emergency, emphasizing the severity of the outbreak. So far, the number's sobering. 36 confirmed human cases in California, out of a national total of 65 cases, according to the CDC. But for poultry, the situation is catastrophic, with a 90% to 100% fatality rate in infected birds. And even in livestock, such as cows, have seen mortality rates of 1% to 2%. While health officials assure the general public that the risk of transmission remains low, but the impact on agriculture and food supplies is significant. In a concerning latest update from Louisiana, health officials have confirmed that an elderly patient is currently hospitalized in critical condition due to a severe H5N1 infection. This case marks the first serious instance of bird flu in the United States. What's particularly alarming is that the virus has shown mutations that suggest it might be adapting to infect human airways more effectively. While there's no evidence that this virus has spread beyond this individual, health officials are keeping a close eye on the situation. Now let's shift our focus to Europe, where Belgium has detected its first case of the Clade 1b strain of Mpox virus. This makes Belgium the 8th non-African country to report this strain, alongside nations like Canada, the US, and Germany. The World Health Organization has termed the situation especially concerning as cases continue to rise globally. Unlike earlier outbreaks, the Clade 1b strain appears to spread primarily through sexual contact, rather than from animals to human or zoonotic transmission. First identified in the Democratic Republic of Congo last year, this strain has now made its way to the European subcontinent. Mpox typically causes skin lesions, fever, and swollen lymph nodes, with symptoms lasting 2 to 4 weeks. Public health efforts are focusing on raising awareness about transmission and encouraging preventive measures. Let's turn our attention to Yemen, where a devastating cholera outbreak is unfolding. As of December 1st, 2024, Yemen accounted for 35% of all cholera cases worldwide, with 249,900 suspected cases and 861 recorded deaths. This marks a 37% increase in cases and a 27% increase in deaths compared to the same period in 2023. The outbreak is a grim reflection of Yemen's decade-long conflict, economic collapse, and failing healthcare system. WHO representative in Yemen highlighted the crisis. With inadequate access to clean water and sanitation, Yemen's population remains vulnerable to waterborne illnesses like cholera, which thrive in these dire conditions. Finally, we turn to South Sudan, where a troubling rise in HIV cases among pregnant women has been reported. Health workers in Bor, the capital of Jonglei State, are seeing daily new cases of HIV-positive pregnant women at Bor State Hospital. Healthcare emphasized the urgent need for voluntary testing and counseling to help HIV-positive mothers manage their health and prevent transmission to their babies. This increase in cases highlights the urgent need for more stronger public health campaigns, greater access to antiretroviral therapy, and comprehensive antenatal care in South Sudan. All these outbreaks, whether it's bird flu in California, Mpox in Europe, cholera in Yemen, or HIV in South Sudan, highlight the ongoing global health challenges. Right from food security to disease transmission and healthcare access remain one of the pressing issues. And only awareness and preventive measures are key to managing these crises effectively. Governments, Health organizations and communities must work together to address these outbreaks. What affects one region can quickly become a global issue. It's a call to remain vigilant, informed, and proactive. What are your thoughts on these developments? Let us know in the comments below. If you found this update helpful, don't forget to like, share, and subscribe to stay informed about critical health updates from around the world.